Good day, ma'am. My name is NGT Torobia from LaSalle University, Ozami City, and I will be your student nurse for today. I will be going to discuss what is inserting a nasogastric tube procedure. So, what is nasogastric tube? It is a tube inserted through one of the nostrils down to the nasopharynx and into the alimentary tract. So, some instances, this is passed through the mouth and pharynx. This may be felt uncomfortable and cause gagging. So the rationales would be this is to administer feedings and medications to the clients who are unable to eat by mouth and swallow sufficient diet without aspirating the food and fluids into the lungs. So next is to establish the means of suctioning the stomach contents to prevent gastric distensions, nausea, and vomiting. Next is to remove the stomach contents for laboratory analysis. And then next is to lavage or wash the stomach in case of poisoning or overdose of medications. The equipment would be large and small bore tube, guide wires, then solution basin filled with warm water, non-allergenic adhesive tape, clean gloves, water-soluble lubricant, facial tissues, glass of water, and drinking straw, 20 to 50 ml syringe with adapter, basin, pH test strip, then a stethoscope, disposable pad, then clamp, and then specimen bag with elastic band, and then safety pin with elastic band. So the first thing to do is to assist the client to a high Fowler's position if his or her health condition permits. And then support the head of the client on a pillow. So the rationale would be this is the easier way to swallow with this position, and the gravity helps the passage of the tube. Second is explain to the client the plan you want to do. So this is to gain the client's cooperation. Next is to wash hands and observe other appropriate infection control procedures. So this is to prevent from having an infection. Then, provide privacy to the client. Place a disposable pad across the client's chest. So this is to promote comfort. And then the next thing to do is to assess the client's nares. So ask the client to hyperextend his or her head using a flashlight. Inspect for the intactness of the tissues of the nostrils, if there are irritations, deformities, or even abrasions. Select the nostril that has a greater flow. So the rationale for this is to check which nostril to insert the tube. Next thing to do is to prepare the tube. So if the rubber tube is used, place it on ice for 5 to 10 minutes. If the plastic tube is used, place it on warm until the tube becomes softer and more flexible. If a small bore tube is used, then insert a guide wire and making sure that it is in a secure position. So this is for the insertion of the tube. Next thing to do is to determine the distance how far the tube has been inserted. So using the tube, mark off the distance from the client's tip of the nose and from the tip of the nose down to the tip of the earlobes, and from the tip of the earlobes down to the tip of the xiphoid. So this is to approximate the distance from the nares to the mouth. So the next thing to do is to insert the tube. So the first thing to do is to put gloves on to prevent contamination, and then to lubricate the tip of the tube well with a water-soluble lubricant or a water. So this is for ease insertion. Next thing to do is to insert the tube with a natural curve, and then directing on the floor of the nostrils. This is also for a proper insertion of the tube. And then the next thing to do is there is a slight pressure that will be required to pass through the nasopharynx, and then the client's eyes may water. So we need to provide tissues as needed. And then If the tube reaches to the oropharynx or the throat, so the client may felt the tube and then it may gog and retract. So the next thing to do is, if the patient or the client continues to gog and then the tube doesn't advance with each swallow, then slightly withdraw the tube and then inspect for the throat by looking through the mouth. Then the next thing to do is to ascertain the correct placement of the tube. So this placement, this is to locate the tube, and this is also to ensure that the location of the tube is into the stomach and not into the lungs. The next thing to do is to secure that the tube is taped into the bridges of the client's nose. So this is to prevent from having the pressing against the irritations of the edges of the nostrils. So the next thing to do is to attach the tube to a suction apparatus or any feeding apparatus as ordered, or a clamp the end of the tubing. So the purpose of having this procedure is to ensure or to make sure that the tube can be used anytime. So the next step is secure the tube to the client's gown. So this is also to prevent from dangling and pulling. Then the next thing to do is to establish a daily provider of a nasogastric tube care. So this means that the first thing to do is to inspect the nostrils if there are discharges and any irritations or any abrasions. Then next is to clean the tube or the nostrils using a moistened cotton clip applicators. And then next is change the adhesive tape as required, and then provide frequent mouth care to the client. So this is to prevent any complications. So the last thing to do is, if a suction is applied, so make sure that the patency of the suctioned and the nasogastric tube is maintained. So this is the rationale for this is to make sure that the patency of the two tubes is in good condition. And now we're on the documentation and the evaluation of this procedure. So the very first thing to do is the insertion of the nasogastric tube. Make sure to note the date and time it was inserted, and then make sure that the proper placement was determined and the client's response. Then the last thing to do is, if a suction is applied, note the method or the type of suction, the color and amount of the gastric contents, and then the client's tolerance, and then the client's response towards the procedure. I think that would be all, and this might give you or provide you a help in understanding what is inserting a nasogastric tube, and then what is all about the nasogastric tube procedure, what are the things to do and what are the things that you must not do. Thank you, and Animo Lasal.